Fernando Gutierrez.
You're looking at the second busiest emergency room in the state. They treat over 100,000 patients a year. But here's the thing.
Apathetic thyrotoxicosis.
According to Dr. Niels Ratlev, who runs the ER, a quarter of them don't need his services.
The way I would phrase it is to say I think there are alternative sites of care that would be more appropriate.
He means a primary care doctor's office.
The majority of patients who are frequent utilizers of the emergency department actually have insurance. They have a primary care physician, but they choose to come to the ED because they don't have access.
Like Kenneth Mills, who's in pain from a bowling injury.
I went to call my doctor this morning, but I wouldn't be able to get in to see him.
Mills is bruised, not broken, and could have easily been treated outside the emergency room.
Are you sort of surprised that you had to come to the emergency room to take care of something like this?
Well, I wish I had a primary I could just call and come right in. I wouldn't have to wait as long.
That's the issue. Just having insurance doesn't guarantee access. There aren't enough doctors. It is a real problem. According to the Department of Health and Human Services, we are more than 16,000 primary care doctors short in the United States. About 26,000 new doctors enter the workforce every year, but only 6,500 enter primary care. One reason is that starting salaries for primary care doctors are a lot lower than for specialists, like in radiology, cardiology, and urology.
I've been in practice for 10 years now, and I still owe $60,000 in my medical school loans.
But it's not just the pay.
These are all the different forms, the Mass Health ones.
It's the paperwork.
Blue Cross.
Dr. Kate Atkinson is drowning in it and says that's what's keeping doctors away from primary practices.
This is the reason why.
Too much paperwork.
Too much paperwork.
Feet are particularly bad.
The reality here is that Dr. Atkinson and her nurse practitioner treat 3,000 patients.
Aetna, Cigna forms. Oh, there's at least over 100 forms.
But filling out hundreds of different forms takes a staff of 11. She simply can't make ends meet.
Do you know that I lost a staff person last year to Starbucks because they could pay her more money than I could pay her?
To Starbucks, Maggie, and therein lies the point to some extent. If you have health care insurance, it doesn't mean a lot necessarily if primary care doctors like Kate Atkinson can't afford to stay in business. Maggie?
Exactly right, Sanjay. And it's clear that no matter whose health care plan passes, we're going to need more general practitioners. How do you do that? How do you increase the number of family physicians?
Well, I think money is part of this to some extent. Clearly, you saw that primary care doctors make a lower income on average than specialists. There have been some discussions of medical school loan forgiveness programs, which might help, but everywhere we looked, it really came back down to this issue of paperwork. Kate Atkinson has 3,000 patients. Each of those patients generates paperwork. A lot of that comes from the insurance companies. It's just hard for her to get her work done.
All right, Dr. Sanjay Gupta, thank you.